Chair, honorable ministers, gentlemen of the press, good evening. So as we go further in the easing of the restrictions, I just want to remind all of us that the easing of the restrictions doesn't mean the easing of the response. In fact, the response is being strengthened. The public health response is being strengthened as the measures restricting certain movements are being eased. So I really wanted to just spend today to reflect on some numbers with you, because crossing that 10,000 mark was quite a significant, it was a significant event. I won't call it milestone. And every night when we worked very hard to bring out those numbers, sometimes numbers begin to feel like what they are. You forget that there are people behind each number. So it's very important for us to remember that these are people. And at NCDC, we engage with these people, almost every day, same as the state governments across the country. And when you engage with these people, it means a lot more to you than just the numbers. So really, as we report on this every day, let's remember that these are people. Each single number there represents an individual with a brother, sister, family, village, community. The second thing I'd like to say is something around the provenance of those numbers. So we've reported since the beginning of the outbreak on the likely exposure. Right now, cumulatively, just 2% of cases have a travel history. In the beginning, it used to be 80 to 90%. At some point, it was 100% when everybody came back from some country or the other. 23% of patients, of new cases, are contacts of existing patients. So these are people that have been found through the public health response. They are contacts, and when you test some contacts, you find more cases. At the moment, 75% of people have an unknown source of their illness. But what does this really mean? It means that community transmission is happening. It means that you cannot link your exposure to one particular person or one event. And this is normal of a respiratory virus for which 80% of people are asymptomatic. What it does not constitute is fraud. So for a newspaper to present these figures as fraud is irresponsible journalism at the very least. We have been very proactive in making sure every Nigerian is informed. Every night, the team works very hard. Every day, we come here to represent, to tell you what these numbers are. So at least we expect responsible reporting of what these numbers mean. And at least check with other countries what proportion in the US, in Japan, in China, during community transmission, can you identify a known source for? Our percentages are no different than reported anywhere else in the world. So how does this represent fraud? So we need to really understand what these numbers mean. We've had 299 deaths so far, representing a case fatality ratio of about 3%. Now, each of those deaths are very painful, and we report them because it's important to count these things. But also, we always remember, and the SDF has said it here severally, these are people. Some of them we know, and some in my privileged position I've come to know through the course of their illness. So we mourn them and we remember them every time we go out in the morning to work harder the next day. We now have the third highest number of confirmed cases on the continent, just after South Africa and Egypt. It means that there's an added responsibility for us to work harder every day. We've increased our testing capacity. We've now tested over 65,000 samples and increased our lab network to 30. having just activated a lab in Bauchi and one new one in Abuja. Each of these are not numbers. There's a lot of work behind every new lab activated. Means equipment have been procured, people have been trained, people have traveled to make sure this happens. State governments have invested. So when you just hear a new lab activated, it's not just a number. It represents a collective effort of a country trying to respond to a public health emergency. Another number that is important, 60% of our cases are in 20 local governments. And we publish these local governments with the new regulations, with the new easing of restrictions. So this will now define our response even further. Out of 774 local governments, if we have 60% of cases in 20 local governments, it means that we will focus a lot of our efforts on those 20, while not forgetting that we need to prevent spread to others. We've deployed 37 rapid response teams with over 450 people that have left their homes for weeks on end, supporting the response across the country. These are not just numbers. They are people that have left their own families and are working hard to support the response and make sure things get better. We've had 812 healthcare workers infected. They're not just numbers. 29 of these work for the Nigeria Center for Disease Control. There are people I know. They have families, wives, children. About 8 of them right now are in the Do Treatment Center. So they're not just numbers. They are people, and they matter, and we must remember. We've distributed over 40,000 pieces of complete PPEs, and we continue to do this. By this weekend, a new consignment will be going out to every state, every FMC in the country. So they're not numbers. These are life-saving commodities. So finally, one that will interest you, over 150 different jingles have been developed and aired, different languages, different formats, and we've sent over 100 million text messages through the support of MTN, Glo, 9 Mobile, and all the big telcos. So that's just a little bit of a reflection of what these numbers mean. Behind all these numbers are people, our efforts, our organizations responding to this outbreak. But the most important number that we will all focus on in the next few weeks from the public health side is to keep pushing to test more, to establish where we are in the outbreak in order to guide the response. So this is my bit for you today, to always reflect when you see the numbers, what those numbers mean. And remember, look for explanations. Sometimes the use of strong words like fraud really comes to the heart of many thousands of people working on this response across the country. Thank you very much.